Wrapping up for us today is Dr. Keith Smith, one of the founders of FMMA. He started us out, and I know he's going to inspire us all to go punch some crony capitalists by the time this is done. Thank you.
Let's give Jonathan a hand. This has been awesome. I'd also like for the students, Benjamin Rush students, to please stand wherever you are. Special thanks to Jay Kempton, Jeff Davenport, my friend Jody McAllister in Arkansas, who's not able to make it. The three of them and me, we brought four of them here. So we are so glad you all are here. And I gave them the advice I give all medical students, and the only advice I give medical students, and that's never, ever go to work for a hospital. So. I want to talk a little bit about politics, and we're going to do that at the end. We're not going to do it now, but I'm going to start with a thought that I think it's ironic that we see the folks, however you want to characterize them, the collectivists, the progressives, the left, clamoring for socialized healthcare, free healthcare, when it was really this free market movement. And really, Steve Vellante and I, the Surgery Center of Oklahoma, we're working with HealthSmart and the Kempton Group that have actually delivered free health care to the employees of Oklahoma County and to the employees of Oklahoma Blood Institute. So I think that is something really we need to ponder, is that for all the promises that the government might make regarding health care, it's really the free market that is delivering quality and results. I want to talk a little bit about pricing before we talk about politics. Most of you have followed me, know my views on government. I see, like Rothbard's definition of government as a monopoly on violence. Also, like Bastiat's definition, government is that institution that allows us to believe that we can live at the expense of everyone else. And so, I see people who are in government positions as indistinguishable from politics, and I see anyone in government as violence and a candidate as the threat of violence. And so the idea that government has any position in healthcare, I reject. That we have to be involved and protect ourselves from this syndicate is real. And Jonathan is right. The Surgery Center of Oklahoma has not supported any political candidates, I don't think ever, with one exception. And it was a Democrat. And his name was Dan Boren. And back in the old days, the Democrats in Oklahoma were the ones who saw the Surgery Center of Oklahoma and others like us as the underdogs. And they recognized corporate health care as the evil underworld that it was. So we had Democrats really being, and OCPA, Brandon Dutcher and Jonathan, Michael Carnuccio, we had these people wearing these bulletproof vests in front of us. And really the Democrats were the ones who had our back, not the Republicans. That has changed. The Democrats in Oklahoma now are what I would call the hard left, but I'm going to get to that at the end and why I think that's interesting and how FMMA is changing that. The Republicans now some of them still are dipping their beak in the crony capitalism creek, but that's becoming less and less common because they're more and more exposed. So we have Republicans in this state that really act as libertarians, and they love the free market and they love what we're doing, and they respond to the very cogent and articulate arguments that come out of places like OCPA. So while we never support political candidates, with one exception, one time, while we never do, we heavily support OCPA, and I would encourage all of you to do the same, whatever state you're in, because they really are, they're doing the really sludge, shovel work in the cesspool of government that most of us can't stand. a little bit about pricing, and that will lead me, I think, to my final comments about politics. And FMMA is an apolitical organization. This is not some right-wing bunch of wackos. We are just free market. And the most powerful part, I think, of the Free Market Medical Association really doesn't have anything to do with healthcare, and it has to do with changing people's minds. But I'm going to get to it. Pricing. The cornerstone and the benchmark of this entire movement must start with price transparency. And I spent a lot of time in my remarks last year in this organization making that very clear and dissected it as best that I could. That is where it starts, because without a price, the consumer can make no effort that's meaningful in determining value. None. It starts with price transparency. Subsidies that interfere with the ability to know the real price are something I'm going to spend a lot of time on in the next few months delving into and explaining to people, because the subsidies that are present, people think, my Obamacare plan costs $200 a month. Well, it really doesn't cost that much. I mean, it costs a whole lot more than that. It's just $200 for them. Just like my gallbladder costs, $250 plus my 20% copay. No, it actually costs more than that. So the power of pricing has shown itself here in Oklahoma, and it's showing itself all over the country, as you all have heard today. It's very validating to hear all of the speakers that are all over the country. I mean, Adam Russo, your presentation, everybody all over the country knows now that the lie of we cannot post prices is just that. It is a lie. In Oklahoma, we are already seeing a price deflation. There are people that are flocking to this movement because they see the wisdom of it, and they see that it's the right thing, and they see that long term it's better for their organization as a provider. There are other people who are scared to death, and they are coming to this movement. I get emails, and I should have saved them, but I get emails from physicians that follow the Elizabeth Kubler-Ross grief pattern. So we'll have a patient that goes to see a surgeon in Des Moines, Iowa, and the surgeon says, you need an ACL, an anterior cruciate ligament reconstruction. And well, I don't have any insurance. I'm a raw milk dairy farmer, and I don't believe in insurance. We see those people all the time, and they say, we'll try to get you a price. Well, they get a price, and it's always the institutional abuse, not really ever the physician abuse of charging. And it's ridiculous. You've seen the numbers. It's 30,000, whatever they come up with. So they tell the surgeon, I'm going to Surgery Center of Oklahoma. The surgeon's first email to me is just denial. And you know what's coming. The next email is rage. Rage, how dare you? You're leading the race to the bottom. That's my favorite. And then sadness. Every time. It starts with denial. You can't be real. How dare you? How dare you dupe these patients with these unreal prices? It's just total denial, then rage, and then sadness, and then just complete hand-wringing, and in a desperate plea for me to help them out in some way, and then acceptance. And those are my favorite emails, because the acceptance email is, how can you help me do this too? And I say, well, you come down here and buy a t-shirt. Actually, the t-shirt purchases are probably what will shield Jay and Charlie and I from a cash call from the bar tab. So thank you all. Anybody, if you don't have t-shirts, it still helps. So the pricing is causing this great deflation, and it's happening. It's happening all over the country. And the other thing that it has done, that Steve and I knew something was wrong, but we did not know what it was. We knew we were cheaper. We knew we were better. We really did. I mean, we actually have 60 surgeons at our facility now, and we've added cardiovascular, we've added oral surgery, pediatric dentistry, and we continue to add more and more modalities of care. We knew something was wrong, but we didn't know what it was. And again, the price transparency has not only provided this incredible competitive power to lower prices, and not just for the self-funded crowd, but for individuals. I mean, it's making everybody question these crazy prices. So you're seeing the deflationary power, but it also was a giant beacon of light. And we didn't see this coming. We knew something was wrong, but we did not know posting prices would actually reveal to us and to many others what the real problems and scams were in healthcare. And I've talked about the scams at length. I owe it to people that are inside of this industry that have helped me understand them. There is one giant scam that I'm going to focus on in the next 2 to 4 weeks because I'm completely unhinged, and other people probably are not going to be comfortable talking about this one, and it has to do with the brokers and how they work, what they do, why they're a problem, and why I believe they are the biggest obstacle to this movement. I talked to a group of physicians last week, and it was a little bit too good to be true, and all the questions, this is impossible sort of stuff. And then one hand-wringing, very fear-filled physician, doctors scare easy. So he says, well, aren't you afraid the government's going to come in and shut you down? And I said, no, I'm actually afraid they'll come in and try to help. There were 3 or 4 people that left when I said that. But they always screw things up. They always get it wrong. And maybe they're trying to screw it up would actually screw up. So I don't know. But anyhow, the scam of the brokers is going to be, I think, very revealing. Some of you, and many of you in here have heard my take on how repricing works and how that leads to higher charges, and the fiction of the not-for-profit status of the hospitals, and how they sell an aspirin for $100 and are happy to get $5 for it even though they paid a penny, and don't you know they lost $95 in that transaction, and that $95 goes into a bucket that they call uncompensated care, and then they ship that off in a cow cart to Washington, D.C., and get their kickback in the form of these disproportionate share hospital payments, and it just continues, and it continues, and this is the scam. And then, the insurance company, they go to the employer group and say, we saved you $95 on this $100 aspirin. Aren't we great? And we got this huge discount, and now per the terms of our contract, you owe us a percentage of the savings. So if you think through that, the PPOs, they do not want. They want that aspirin to be $500. So that is how the scam works, and I've talked about it now for quite some time. And the only reason that I've been able to wrap my mind around how the scam works was the light of pricing. Without putting the prices out, we would not know. We would not know how this scam worked. All we knew was we were better and cheaper, and why don't they want to come to better and cheaper? Why do the PPOs hate quality? Why do they hate straight up guaranteed pricing from, I would argue, the best surgical staff in this whole region, not just in Oklahoma City? Our surgery staff, they're just incredible. And that's why they want high charges. And the hospitals, of course, I learned later, constantly contract with carriers with the understanding that specific providers in the community be excluded. And that is why, Tom Bartlett, I use the word cartel so often. They really do work like a cartel because these agreements shut out competitors, and that is going on all over the country. But my favorite thing, and I'm about done before we go to politics, my favorite thing that the pricing has done, it is changing minds. I cannot tell you how many times, and I don't know if Bill, you're still here, and it happened at Bill's facility when I went to Virginia. This woman who was a primary care doc, she walked up to me and she said, "I've followed your videos, I've read all your blogs, and I cannot tell you how opposite I am to you philosophically. I am in opposition to every single thing you have said philosophically, but I can't argue with cheaper and better." So she was do you remember this? She was closing her practice and going to a direct primary care model. Had actually already done it and was having pretty good success. And you guys didn't even know she was in the community. And so she's an instant source of referrals for Bill Grant's facility. But that really struck me because I had received these emails from people from time to time. You know, I consider myself, I'm a proud progressive. I'm a proud leftist. I'm a left-wing wacko. But I'm coming to your facility because everybody else is going to bankrupt me. Now, that is powerful, because if you wanted to say free markets do not apply in one industry, you did a poll, how would they fill in the blank? I've asked this more generally. Freedom is a good idea except for blank. How do you fill it in? Think about how you would fill that in. Freedom is a good idea except for blank. Or free markets are a good idea except for blank. How do you fill it in? More importantly, why do you fill it in the way you do? Perhaps even more importantly, how do you respond to someone who fills that in differently than you? Is it civil? Is your response civil? Or is it a challenge for you to dig deeper for inconsistencies in your own thinking? I've thought about this a lot, and it comes no surprise. I mean, my idea is freedom is a good idea, period. There's no blank there. Just freedom is a good idea, period. But I always find that an interesting question with somebody with whom philosophically I'm not in complete agreement. But if you ask most people, free markets work great, except pick one, they'll say healthcare. Yet, here's Jonathan Small, who is energizing the teachers union. I mean, that is a very predominantly left-wing group. Oklahoma County, those are not highly compensated employees. And so for these people to receive the benefits of the free market, for them to receive this outrageous quality that we have at our place at this pricing, is their introduction to the possibility that free markets work across the board. Because my God, if it works in healthcare, I might need to reevaluate my thoughts about freedom in general. And I am so blessed and fortunate, and Steve is too, to be in a position where we see those minds change. And that is really the most wonderful thing, I think, about, and the most wonderful effect that the pricing has had that we see. And anyone who takes the steps and goes down this path, you will see it too. And that is what I wish for you, all of you. Thank you for attending our conference. We have the pricing seminar. Is there a break, Charlie?
Yes, break. We start the pricing seminar from 3 to 5.
Thank you. Once again, you guys have made this conference great, and we will see you next year, and we'll let you know where. Thank you.